Welcome. This is To The Root Podcast, brought to you by We Grow Hair Indie and Transitions Indie, where we get to the root of hair restoration solutions, navigating hair loss, embracing life's journey, and everything in between. Hey everyone, welcome back to The Root. Today we are here with Lindsay. She is one of our trichologists that we have at Transitions Indie and We Grow Hair Indie. Super excited to have her on this episode today.
Thanks for having me.
So today we're going to be in discussing things that are a little bit more in your wheelhouse with frequently asked questions with female hair loss, right? And
absolutely.
what's kind of causing that, what's different about, female hair loss versus male hair loss. And, I know we meet with a lot of women, and many people don't necessarily think like females or like women go through hair loss, but the reality of it is that quite a few do. The hair loss is not just a thing with men, but I guess to kind of get things started, tell everyone here a little bit about you. You're a trichologist, right?
Yeah,
so
absolutely.
What does that mean exactly?
Yeah, so I am a certified trichologist. I have my license in both looking at the hair and the scalp, more from a homeopathic level. I'm not quite your MD or your dermatologist, but hair and scalp is all I look at. I'm actually a hair loss practitioner, so my background is in the hair loss side of things and how I can do to help. And luckily, I work for We Grow Hair Indie and Transitions, where we have all the different solutions.
And we're super fortunate to have you as well. And I think one of the things that you just mentioned there hits the nail on the head, right? It's like we specialize in hair.
Absolutely.
And it's a really important thing, that this is not a one size fit all, and we've talked about that before in previous episodes as well. And when you're looking at why someone's losing their hair, you have to take into consideration age, genetics. You have to look at their previous history with regards to medical conditions, but obviously also their gender, because it's very, very different in a lot of different scenarios. So importance on making sure that when you are looking at different solutions, that all those things are being taken into consideration.
We're very well known around here for our hair transplants, and that's great. But, a lot of times the treatments are the other things that people don't know a lot about.
Yeah.
And that's typically where we like to, help with that female loss. So kind of, putting, a little bit of a spotlight on it is going to be great, so people can know that we're not just a hair transplant clinic.
Yep.
We do lots of other things.
Yep, that's perfect. So let's go ahead and let's start off with obviously the question that we get asked all the time, right?
Yes.
Why am I losing my hair?
Absolutely.
So specifically with women, what is it that you have seen most commonly?
Yeah, so I have seen hair loss. I've been with We Grow Hair Indie for almost 10 years, so I've seen it.
It's crazy it's been 10 years.
Yeah, 10 years, a full decade, guys.
It definitely does not feel like it's been that long.
I know.
So.
It doesn't. But it's great to kind of spotlight on why am I losing my hair, right? Women typically, we'll see shedding here and there. Hey, we have the seasonal shed that happens usually in the springtime, close to the wintertime. Those are just things that happen. But a lot of times we put things off, thinking, hey, things are going to get better, right? The shedding's going to reduce by itself. Or, hey, sometimes we don't notice hair loss till we've had it. We've lost some density. We're seeing scalp, stuff like that. And
now, and at times, yes, the hair loss can kind of resolve itself to some degree, but most of the time it's keeping an eye on it and understanding, like, okay, is this excessive? Is it not excessive? Is it over X period of time? And just being kind of aware of that, not hyper focusing on it, but it just because you're shedding doesn't mean it's like an uh-oh moment, right?
But, so shedding is normal, right? We got to shed some hair sometimes, but when it starts to become more excessive to you specifically, so I know a lot of people say 50 to 150 hairs per day is that normal hair loss, but I've had some clients where they almost never see that hair loss in the shower, never really see it in the brush, never have to clean out, their brush after styling, stuff like that. Now all of a sudden they're seeing it, and they really haven't changed anything in their routine that would, kind of indicate why is this happening? And those are kind of those things that, we should be a little bit more attentive on. And, luckily you can come on in and see us and we can evaluate the hair and see what's going on and kind of make some suggestions on how we can help. But going back to that, why am I losing my hair?
Yep, perfect.
I mean, we got hormone changes, we have stress, we have illnesses, medication changes. I mean, there's a lot of different things that women go throughout their life. And I mean, of course, age and all of that stuff too does play a factor. So, with some of those things and some of those changes, up and down moments, stuff like that, being aware of those changes in your hair, we can be proactive instead of reactive to that hair. We can be proactive in helping it too.
Yeah. So and it's, you kind of touched on like the age aspect of things, talking about like, menopause, postpartum, all those different things play roles in it. And I think probably one of the biggest things that I've noticed whenever I do have the, have a woman for a consultation is it's like the hormonal fluctuation of things, right? I feel like that's kind of the biggest key point where understanding what areas the hair loss is happening.
Absolutely. So, I mean, with hormonal changes, obviously, I'm not just talking about menopause. We have the postpartum shedding.
Which you actually have dealt with yourself, right?
I have. Yeah. So, 2021. How
are the kiddos doing, by the way?
They're doing great. Yeah. I got almost 4-year-old and 3-year-old happening.
That's awesome. So, still wrestling?
Still wrestling. Well,
not the 2 and 3-year-olds, obviously.
No, my big kids
they might be
are
wrestling each other.
Yeah,
but,
no, they are. But no, my big kids are wrestling right now. It's actually that season time. We're just gearing up for the next couple months for state runs and stuff like that.
That's awesome.
So it'll be exciting, which
cool.
also causes some stress sometimes too. So there you go.
Can.
But no, I mean, back in 2021 and 2022, I had my kids actually back to back. They're 11 months apart. So when I really started noticing the hair loss was actually about 6 to 8 weeks postpartum with my second one.
And my wife actually kind of went through the same thing too.
Yeah. So, and, at first, I mean, I knew this was going to happen, right? But, I kept an eye on it after I started noticing that things were, just not, they were regrowing, but not as healthy as they once were. My length was starting to suffer a little bit, stuff like that. It was harder to hold style and keep style. I ended up doing some of our proven solution treatments, actually.
Awesome.
So
yeah, which we'll actually be talking about that in a later episode as well, which is going to be awesome. I'm looking forward to discussing on kind of the intricacies within those different treatments.
Yeah, absolutely.
And so I'm going to pivot a little bit, but I guess why does hair loss kind of present itself differently in women versus men? Because men really commonly just have hair loss up on top, right?
Absolutely.
I mean, genetic hair loss, male pattern loss, receded hairlines, thinning in the crown, and then the hair along the back and the sides, right? Which what we can kind of consider the quote unquote like donor area, right? Because if you're looking at doing a hair transplant, that's the hair that you use.
Exactly.
But with women, you tend to notice a little bit more of like a global thinning. It's thinning not just up on top, which can happen, and women can also have receded hairlines or male pattern loss, but they also tend to present it in the back and the sides. So I guess talk a little bit about how that kind of is different and why that's important to take into account and those types of things.
Well, I mean, we as women, I mean, obviously one of the first questions I always get is, can I do a hair transplant? And, with women, there is a little bit of that discrepancy because, again, donor area is a very important thing.
Yeah.
Women can see hair loss back here. And usually when we are having those hormonal fluctuations, sometimes those, things due to illness or even like weight loss.
Which I've actually been seeing that quite a bit now with like the semaglutide shots and this and the other, where the body is just kind of like, I mean, you lose so much weight in such a short period of time that your body's like, oh crap, what is happening?
Well, yeah, and it's actually it's very similar to, I mean, I hate to relate it to the same thing as bariatric surgery, but you got to think it's one of those things that you are making a very different lifestyle change. Your body is so used to one thing, and then when it's not doing that and it feels like it's not getting what it used to, it does kind of go in that survival mode. And unfortunately, even though we love our hair, our body doesn't deem that as as necessary. I mean, we can survive without hair, right? So there's a lot of nutrients, a lot of vitamins, a lot of protein collection, everything that goes into your hair. And when our body isn't doing as well, or it needs those other things to operate other things in our body, then the hair takes that backside, right?
Taking those things into consideration, obviously, are really important because, and we talked about this a little bit before we got on this episode. When you're talking about doing treatments with women versus men, women in particular, it's super, super important not just to think about what's happening on the back and the sides, but also where's it thinning up on top. If you're thinning in the crown, sometimes that could be hormonal as well versus genetic. It could still be genetic as well. But the key thing that we always want to make sure that we do is think about someone where they're at right now, but also what could that look like in 5, 10, 15 years. It's our job to think about the future you, not, and obviously
not just the present.
Yeah, because everyone that walks in is worried about the now.
Right.
This is where they're at now.
Exactly.
So just because it may look like the right time to do something like a hair transplant now doesn't mean that something couldn't change in the future.
Right.
And so age and things like that again also play a role in those types of things.
Exactly. And some women do have some genetic side of things that tailor into that too, but we can thin throughout the top of the scalp as well, not just the sides and the back, and it can diffuse out very much so. So it's not just that simple, hey, we have a pattern, we have a receded hairline, we have, just a loss in the crown, stuff like that. Now, there are some women that do have that male pattern baldness, but, a lot of times, more times than not, I'm seeing other types of hair loss in there.
Which is super important when talking about treatments. And the good news, though, women actually have it pretty good with regards to treatments because they respond very, very well to those different modalities.
Absolutely. I mean, the benefit is that, a lot of times we can catch it at a point where there can not just be stabilization, but also improvement. And that's kind of a big thing with treatment. We need to stabilize that hair loss, get things at a better state. But of course, we're looking for improvement too. It would be nice to get a little bit of, thicker hair back, that density, that length, stuff that, we are either slowly losing or dramatically losing. But we always have to start at square one. We need to reduce that hair loss.
Absolutely. So basically in summation, right, it's so the different reasons for the hair loss, again, hormonal, genetic, we've got stress related things, medically related. When you're doing a consult with a lady, what would you say is the most common thing that you've kind of run across with regards to what's happening?
Honestly, it's a kind of a cross between the stress side of things and either that premenopausal or even in menopause or postmenopausal hair loss. I'm really seeing a lot of those kind of things. Now, obviously, there's some in between. Sometimes those factors are together, of course. But, those are things. And, also women, too. There are some that do hormonal therapy. So that's like a whole nother, little piece to the puzzle there. And so there's a lot of different things that go into our hair loss and a lot of things that we need to address. But looking at that global approach, treatments can help pretty much most of those issues. So,
and since we got a little bit of extra time here, one thing, let's talk about trichology.
Yeah.
Right? And the importance of scalp health, how that impacts the overall hair health. And because
absolutely,
I think the biggest thing I notice as well with women, whenever I get the questionnaire, I'm reading through it, I see on there, it says, how do you consider your scalp health? They'll say, dry.
Yeah.
How's your hair? Well, oily or damaged. Like, well, those don't really match together,
right?
Right. And so there's a common misconception of all right, my hair looks damaged and it feels dry or brittle or something like that.
Absolutely.
And so I must have a dry scalp, right?
Absolutely.
But that's not necessarily the case, right?
It's not necessarily the case. So we always antiquate, and usually when people think of their scalp, they are thinking of their hair in it too. So if the hair is dry, the scalp's dry. Or, if I have flaking, that's automatically dry flaking. And those things can actually be on the other side of the spectrum too. You could have an oily scalp and dry hair. You could have dry scalp and dry hair. You could have regular hair and an oily scalp. I mean, there's lots of combos in there. And it's very important that when we are looking, because of course, kind of the first things that we like to look at is the products, potions, and lotions side of things to help address our hair loss, right? You know, we might use supplements, we might use like the DHT blocking shampoos, stuff like that.
Yeah.
But the problem with some of those products out there is they're not really taking your hair and scalp into consideration. They're either not that great for the hair, maybe they're helping the scalp a little bit, or, you know, we are having also to the issues of, okay, it's not helping the scalp, it's actually being counterproductive in some cases, or adding to the issue. And so it's very important that, you know, if we're going to use products, if we're trying to help with the hair loss, we need to get the right regimen for you. And what's readily available out there, unfortunately, really doesn't focus on that scalp like that. It's kind of a one size fits all, like, hey, if you have flaking, let's go to Head and Shoulders, or, you know, if you have this,
I had that conversation with a guy today.
Yeah, and I mean, it's common, you know, but there's so many other solutions out there, but trichology is a very kind of specialized field, and not everybody, you know, looks at those things, but we do. We have even that analysis to do that.
And to tend to go on to that, and that this will, again, I think we'll touch on this a lot more in that next, you know, episode, but products in my mind, like shampoos, conditioners, different serums. I mean, you're a trichologist. This is your baby, right?
Yeah,
I mean,
absolutely.
the scalp health, that's everything,
That's
right?
the bread and butter. I mean, that's what your hair comes out of.
Right. So it's a step in the right direction to allow for treatments and different things like that to work as efficiently as possible. If you have too much oil on the scalp, that can create some topical irritation. It can cause for the cuticle of the hair shaft to be more damaged. So as it grows out, specifically for people with longer hair. So it really all starts kind of with prepping.
Exactly.
And then allows for things to work better.
Exactly. I mean, I always like to use the analogy with my clients and saying, you know, it's not like you can't grow things in unhealthy soil, right? We can grow a plant in unhealthy soil, but
just might not be the healthiest plant.
It's not going to be the healthiest plant. What if we prepped it? What if we added Miracle Grow? What if we made sure it's the right type of soil, right? Then that plant can thrive. It's the same thing with your hair. You kind of got to treat it like that plant. If I'm creating a hostile environment for it to live in, super hard for your hair to do everything it needs to do. And you're already getting inflammation at that cellular base, sometimes due to the hair loss cause. And then if we're getting it on the scalp too, now we got a couple different things. But we have and always love that global approach to your hair loss. Treatments are going to help with one thing, but then there's other little pieces of the puzzle that can help too. And I don't think it's one thing, hey, this works over this or this works over this.
It's all together.
It's all together.
Yeah.
It is a global approach. It's just like working out. You could count calories, lose some weight, but then again, at the same time, think about it in that way.
You gotta do all those other things too.
You can work out. You can do, you know, your cardio, your weightlifting, and nutrition. Global approach, same end goal in mind. I like to treat hair kind of the same way. Global approach in mind. It's very important. And then things after treatments, things to help, you know, maintain that hair and stuff. Definitely get on those right products because that'll carry you into other things too.
I love it. So, I mean, basically, if there's a lady that's out there listening to this that is, you know, just feeling like all hope is lost, or maybe that this isn't right for her, or a little bit nervous to even walk in, just know that, you know, it's a safe place. We're here to help, and we have plenty of options that can give you clarity. And our number one goal is always to educate and make sure that people have what they need to make the right decision for themselves, or at the very least, you know, have some comfort in knowing or having a little bit more knowledge and know that you're not alone out there as well.
Right.
So
you're not alone. We're here to help you out. We've all experienced hair loss at some facet. We've all done something to address our hair loss at some point. We have that expertise to help you out and navigate you in the right direction.
Oh, that's great. I love it. So, well, look, it's been awesome.
Yeah, absolutely. Thanks for having me. I was really excited to come on the podcast, you know, get to talk about different things that, you know, I get to see day in and day out. And, you know, I hope to help some of these ladies out here too.
You already have. You've helped out hundreds and hundreds of women before in the past, and
absolutely,
and we'll continue to do so.
Absolutely,
it's a pleasure having you here. So, and thanks for taking a listen here. And next time on the Root, we will have our consultant Nate. talking about how to get prepared for your consultation. The do's and the don'ts, things to kind of come in ready with to make sure that you get the best information that you need, and allow for us to also give you the recommendations that are needed as well.
Yeah, absolutely.
Again, remember we have free consultations for both Transitions Indy and We Grow Hair Indy. These are all personalized, one-on-one, private evaluations, and super excited to help out anyone that wants to come in and see us.
Absolutely,
So,
come see us. We'd love to
Yes.
help you with your hair and make you feel good about it again. That is the main thing.
love it. Thanks again. Email us at info@wegrowhairindy.com with your questions or topics you want us to cover. Head to our website to schedule your free consultation with one of our experts. I'm Will Sattler. Thank you for listening, and catch you next time.